Hi, and welcome to the crash course-like thing on pharmacology. My name's Angie, and I'm going to be today teaching you the basics of pharmacology, the basic principles on which everything's based, you know. However, I am doing this with an assumption that you understand the basics of human anatomy and physiology. If you don't, let me know, and if there are enough people who don't, maybe I'll make a video series on that if you want me to. I'm not going to be doing too much detail. It's not like you have to be super good at it. Just understand the basic systems, basically. Not even, like, chemical-y stuff. Just know that they're there. Essentially, drug action is based on 4 basic principles: absorption, distribution, metabolism, and excretion, or ADME for short. For all drugs, the beginning is how it is put into the body. Now, a lot of people automatically think pills, capsules, stuff like that, what everybody calls pills. That's the enteric route. It goes through your enterics, it goes through your digestive system. And the problem with that is, there's not necessarily a problem with it, but everything that goes through your gut and gets digested and such goes to your liver first, where this wonderful thing called first-pass metabolism happens. First-pass metabolism takes a good chunk out of your drug dose, so you have to give a lot more than what's needed in order to get the proper effect, because you lose so much of it to liver metabolism before it even goes into proper circulation. But more metabolism in a minute, because we have to finish absorption and distribution before we get to metabolism, right? However, absorption and thus distribution is nearly 100% with intravenous, which everybody knows, nice big line in your arm right into your blood. However, there are other injections also that aren't quite 100%, but they're still a lot better, and there are a lot more injections than you'd probably think. A lot of people think, oh, I'm getting an injection, or I'm getting a needle, but there's a lot of actual different routes involved in that. There's subcutaneous, which just goes just underneath there, just in. There's subdermal, which if you've ever had a tuberculosis test and you get that bump, or allergy testing is the same thing. It just goes into the dermis of your skin, which is also where tattoos go, and you get a little bubble of fluid there. There's also intramuscular, which is probably if you've gotten, like, vaccines and stuff, and it goes psh, right in there and you feel it when you move your arm. That's intramuscular, and you need to move to circulate the blood to get the drug to go where it needs to go. There's the beautiful, wonderful thing that I'm sure every pregnant woman or woman with children knows, or anybody who has watched anything to do with childbirth, is the epidural. There's this thing in your spinal column called the durameter, and it's basically a covering of the spinal nerves. If you don't know, that's good enough. And what the epidural does is it goes just between 2 of the vertebrae in your spine, and it just goes just outside the covering of the spinal cord. It releases the fluid, it takes a little while to absorb, and then it numbs a lot. That's different from the actual spinal injection when it goes right onto the spinal nerves. So you can imagine how important it is to stay still during that procedure. Just a big needle going into your spine, No big deal. So I guess you can imagine how important it is for painkillers at that time if you're willing to risk paralysis, among other things. And the one that at least I always tend to forget is the less thought of dermal absorption, like nicotine patches or those new birth control patches, or some things that you put in your mouth, like lozenges. Some of them actually don't go down your throat. Some of them are meant to be absorbed in the skin of your cheek. Also involved with dermal absorption, skin absorption, like when you have to put your medicated ointment on something. Those are generally more for the specific area, unlike a pill or an injection where you're taking it and it's going everywhere for everything. Those are more localized. Basically, you got like creams and lotions and that kind of stuff. Those are slightly different again. Again, I'm not going into the details of how things work, just understand that they're there. So next time you have a lozenge, you should probably read the directions first, because you might not be getting the proper action out of them. I know nicotine gum, you're not supposed to nom nom on. It's actually supposed to go in your cheek. So that's kind of absorption and distribution together. Some drugs get a little bit absorbed by the stomach as well instead of just in the intestine. Metabolism is a fairly big chunk of thing. The big part of drug metabolism is done by wonderful liver enzymes, mostly the cytochrome family. They start with CYP450s, and there are like 6 major ones, and then a whole bunch of other little ones that do the bulk of the metabolism for you. However, there are some drugs, and I don't mean like hardcore drugs or prescription drugs or anything. I mean, some of them are as simple as caffeine, and even grapefruit juice can do this. They can inhibit some of those enzymes, and that means that your drugs are not getting metabolized properly because the amount of enzyme has been decreased. So you have to be careful, because the normal dose of what you're taking is going to overpower your metabolic ability. So you need to be a little bit careful. That's a drug-drug interaction. And this also is the area where you can get toxic metabolites, which is a fancy way of saying The compounds the enzymes break the drugs down into can hurt us. Like Tylenol. When you OD on Tylenol, the metabolites are what's hurting you. Or, for example, when you take codeine, your body actually breaks it down to morphine. There's 2 steps to drug metabolism. The first one is basically designed to make the drug fit into the second category of enzyme. It's just a helper stage, is the way I imagine it. Then the second stage is where it really gets broken down into something that our body can package and deal with and get rid of through excretion. About 90% of the excretion ability goes through either the urine or the feces. Most everything goes out through the kidneys, hence why drug tests are pee in a cup. However, when you think of other tests, such as breathalyzers for alcohol, the metabolites are coming off of the breath, meaning some of the metabolism is coming out through the lungs. Some of the excretion is coming out in your breath. There's not many drugs and there's not much excretion through other things other than the urine and the feces. So just keep that in mind. Now, hopefully you understand some of the basic ideas of how that works and why you have to be careful when you're taking a bunch of different drugs, what they're doing to each other, and what they're doing to your body. And also why some people just can't take certain drugs because their liver isn't working properly or their kidneys aren't working properly. It's not going to be good for your body at all. I think that's pretty much it for this basic episode on the basics of pharmacology. Next time I do an episode, we're going to be getting into some of the more interesting stuff when we cover antibiotics. I'm sure pretty much everybody has been on an antibiotic at one point or another. We're going to be talking about the different classes, what the different classes are used for, some examples of them, and why they're used now, and why they might not have been used in the past, or why ones that were used in the past aren't really being used now. And a little tiny bit of how they work, because we don't want to be getting into the whole big, wonderful organic chemistry that I don't understand, because I'm not good at organic chemistry. So, until next time, guys, don't forget to hit that subscribe button, and best wishes and DFTBA.